This is the Perineal Care video. We are going to be bringing in a barrier, a pair of gloves, a pink pad, a bath blanket, a towel, 4 washcloths. Let's begin. Knock, knock. Hi, Kendra. My name is Cindy. I'm here to clean your private area. Is now a good time? She says, yes, it is. Notice that I did not call it perineal care. She has dementia, and so I have to use language that she can understand. I'm setting my supplies down, beginning with my barrier. I'm setting my supplies down, and I'm leaving room for my basin later. I'm going to sanitize my hands, rubbing until dry, pull the curtain for privacy, and then I'm going to lock the brake. I'm not going to get my water yet. I don't want it to get cold while I'm working, so I'm going to do as many things as possible until then. I'm going to start by putting on gloves, and then I have to put this incontinent pad underneath her. Kendra, I'm going to put this pad underneath you, and I'm going to help you roll. On the count of 3, I'm going to help you roll over. 1, 2, 3. We'll roll that right underneath her, and we're going to roll back. 1, 2, 3. I can't reach across my residence, so I'm going to walk around her bed. All right, Kendra, I'm going to unroll that pink pad on this side. Let's roll. 1, 2, 3. Next, I need to provide for her comfort, her warmth. So I'm going to put this bath blanket on. I only have to put it on the upper half of her body. Okay, I'm going to pull down her sheet when I get back with my water. I don't want her to get cold. I'm getting my basin. I'm going to put my soap on my barrier, and I'll be right back. Walking to the sink, I'm going to use a barrier to turn on the water, check the temperature. Whenever I work with water, I have to ask my resident, Kendra, will you please check the temperature for me? And she says that it feels just perfect. Let's put the basin on the barrier and move everything around so that I don't have to walk so far away. Since I'm not going to be leaving my resident's bedside for a while, I'm going to raise the bed up to about my hip or waist height. Okay. So now I'm going to pull this sheet down. I'm only going to pull it down to about her knees. I'm not wanting to get her too cold. I'm going to help her frog her knees. And I'm going to put this up here, and I'm going to try to keep her knees covered, but keep this down so that you can see what I'm doing. Next, I'm going to fold the bath blanket and her gown up out of the way because I don't want it to get wet, just up to about her belly button area. I'm going to put a towel down right here so that I can still see what's going, you can still see what's going on, and I can use this to pat dry later. So I have 4 washcloths here. I'm going to use 2 for the front side and 2 for the back. I'm getting my washcloth wet. I'm going to wring it out before I put soap on it. I'm going to pick up my soap, and I'm going to put soap on the first side, flip it over, put soap on my other side. Let's put that away. Let's fold it up into a washcloth onion. I have to verbalize that I'm separating the labia. My first wipe, top to bottom, straight down the middle. Change surface, labia furthest away from top to bottom. Change surface, labia closest to me. Change surface. Groin thigh furthest away, change surface. And groin to thigh closest to me, change surface. So what I wash, I rinse. I'm going to fold that up into my washcloth onion. I'm going to do it all just the same as I did before. I'm separating the labia. My first wipe, straight down the middle from top to bottom. Change surface, labia furthest away. Change surface, labia closest to me. Change surface, groin to thigh furthest away from me, change surface, groin to thigh closest to me, change surface. What I wash, I rinse. What I rinse, I pat dry. I'm doing it in the same order, and I'm going to try to use different areas of the towel to avoid any type of cross-contamination in case there's anything going on in here. I'm going to remove this towel, and I'm going to unfrog her legs, and I need to do her backside. I also need to use 2 clean washcloths. So let's get rid of these 2 that we've already used. We'll just put those in the hamper. We're done with those. All right, Kendra, I'm going to have you roll over on the count of 3. 1, 2, 3. I'm going to pull her bottom a little bit so she balances nicely. And I'm going to try to keep her covered as well as I can for privacy and dignity. Let's move this down just a little bit so we're only exposing her from this area to the hip to the knee. We're doing the best we can. We've got 2 new washcloths. I'm going to get my soapy washcloth. So let's wring that out and put soap on both sides. Fold that up into my washcloth onion. I only have 3 wipes on this side. Ready? We clean from top to bottom. Top buttock, change surface. Bottom buttock, change surface. And I'm starting at the vaginal area and going to the rectal area and up the back, crack to back. That's my 3rd and final wash. Now I'm going to get my brand new rinse cloth, and I'm going to fold it up into a washcloth onion. What I wash, I rinse. I rinse the top buttock, change surface, rinse the bottom buttock, change surface, crack to back, going from front to back. What I wash, I rinse. What I rinse, I pat dry. Same order. Okay. While she's balanced so nicely under her side, let's roll up this incontinent pad and get this out of here. I'm going to help you roll back. 1, 2, 3. There's going to be a bump under you. Okay. Let's get this towel out of our way and put it right in the hamper. Okay. Now I need to go get the pink pad out from underneath her, but I can't reach over, and I'm never going to let go of her. I'm keeping my hand on her at all times. All right, Kendra, I'm going to help you roll just a little bit. 1, 2, 3, and we're just going to unroll that behind her, and there she is. Well, I do need to remove this bath blanket, but I don't want her to get cold, so let's pull that up. And then I can just get that bath blanket out from underneath her or from over the top of her. There. So back to my hamper, I'm taking my incontinent pad and that bath blanket that we're done with, and I'm holding onto her because she's still in a high position. I'm done with these washcloths. Let's put those in the hamper. I need to wash, rinse, dry my basin, but her bed's in a high position, so I'm using my knuckle to lower the height of the bed. And I will be right back, Kendra. Let's put this back. I'm taking my basin of water. That water goes in the commode or the toilet. Just like I wash, rinse, dry my resident, I'm going to wash, rinse, dry my basin. I put soap in it. My wash water goes in the commode or toilet. Rinse water goes in the commode or toilet. Let's dry that basin. Coming back to the resident's bedside, I'm going to put the last of my supplies in the basin, and we'll put that back where we found it. My last dirty supply is that barrier. Let's fold it up, put it in the hamper. Let's take off my gloves, make some slack, dirty to dirty, clean to clean, fold it up inside out, put it into the trash. Now it's time for my evaluated hand wash, just the way you did in your checkoffs. I have to wash for 20 seconds. You can count it out while I'm washing. I'm getting soap on my hands. I'm doing the wrists first, then the back of the hands, palm of the hands. I'm going to do each individual finger rotation, cuticles. Scratch that palm underneath each individual fingernail. This is supposed to take 20 seconds, but for the time constraints, we're going to call that 20. You'd be a little bit more careful when you do this yourself. I have to rinse with my hands, finger spread, start with fingertips, up, 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 drop, up, 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 drop, up, drop, and drop. One last paper towel to turn off the water. My hand wash is done. I'm coming back. All I have left is safeties. My bed is still locked. My bed is still low. I'm going to put her call light, she says, in her right hand, so I'll do that. She doesn't want anything to drink. I don't have any corrections that I need to make, so I'm going to open my curtain, sanitize my hands for hygiene. That's my third hand sanitizer, and say that I'm done.